I'm Lynne Okagaki, Dean of the College of Education and Human Development, and I am so thrilled to see all of you here. I hope, I know many of you, I hope all of you were able to at least see some of the posters and to hear some of the paper presentations this morning. We had some great sessions. I want to thank our faculty members who have encouraged and supported our students in their research endeavors, and to offer my congratulations to all of our students on their presentations. This is the 28th annual Marion H. Steele Symposium, but this is the first time that the Steele Symposium has been a college-wide event. For those of you who don't know, Marion Steele graduated from the University of Delaware in 1928 and began her professional career with the American Home Economics Association. In 1946, she became the editor of the Journal of Home Economics, which is now the Journal of Family and Consumer Science. She dedicated herself to producing a journal that reflected the strongest research of that time. Mrs. Steele was also actively involved in the lives of students, particularly through the International Scholarship Program. At the time of her retirement in 1969, many students had benefited from her generosity. And we can see that generosity extends to us today as we are able to provide this opportunity for our students to present their work. I would like to thank the family of Marion Steele for their continued support of the symposium. For our keynote address today, we are honored to have Dr. Patrick Tolan as our speaker. Dr. Tolan is a professor at the University of Virginia in the Curry School of Education and the Department of Psychiatry and Neurobehavioral Sciences in the School of Medicine. He is director of the Cross-University Multidisciplinary Center, YouthNext, the University of Virginia Center to Promote Effective Youth Development. For the past 25 years, Patrick Tolan has conducted research on the development of youth within high-risk communities and supported efforts to assist and protect healthy development of families. Dr. Tolan has been the principal investigator on multiple funded projects, has authored over 160 publications, and is a frequent consultant to agencies, government groups, and foundations. I was privileged to get to know Patrick when I was at the Institute of Education Sciences and was responsible for assembling some of our first scientific peer review panels for IES. We were searching for scientists who conducted rigorous impact evaluations on social behavioral interventions and understood the complexities of conducting research in school and community settings. Most of these researchers were not funded by the U.S. Department of Education, and their ties were primarily to NIH, and they served on NIH review panels. So it was very hard to find researchers who would give up their time to help a new science agency. But Patrick was one of those scientists who is not only an impeccable researcher, but is incredibly generous with his time and was gracious enough to help a fledgling science agency get started. Patrick, I'm delighted to welcome you to the University of Delaware. We are honored to have you with us today. Please join me in welcoming Dr. Tolan.
Well, thank you, Lynn. First of all, I want to thank Dean Okagaki for inviting me here and allowing me to have this opportunity to speak with you. I'm always excited to be able to speak to people who are on the verge of engaging in a research career, because almost everybody else except for me and your professors will advise against it. And so if we get an opportunity to persuade you to do this, we want to take it. Let me also say one other thing about working with Lynn. So as she mentioned, we got to know each other because IES was started, and the idea was we were going to start to do the kinds of research on education that NIH had been trying to do in lots of areas of human development and disease. So it was a really exciting idea. You know, we're going to go to a new country, so to speak, or we're going to try and see what happens when we bring these two worlds together. And so for me, it was great fun because it really was trying to see what were the issues, what were the challenges, how do you get this moving along. The thing she didn't tell you is how persuasive she is, or I don't think she also told you the extent to which what happened there was because she did things, she made things happen, she constructed it. And that was really impressive to watch, as well as that added to the persuasion, because you thought, well, I want to be a part of this, I want to help make this happen. So thank you. I'm going to talk today about where I've spent a good chunk of my career and part of why I think research is a very valuable and important thing to do. And in fact, I think as we get more focus on research as how do you become the next Apple, or how do you create the app that's going to make you rich, or what's the trick you're going to do to make your MOOC go out and have 200,000 students looking at your lectures, there's an undercurrent to that that's very concerning to me, and I hope is of concern to you, which is that the kind of work that's fundamental and takes a lot of time and energy to understand the complexity of human behavior, to understand the complexity of things like education, but the things that are absolutely vital to the quality of life, whether you measure that in GNP or length of life, or the extent to which, if you take a survey, people are happy and satisfied. These things are absolutely fundamental. These things they're facing threat because they don't produce an app. They don't work through a quick, sudden new idea that's going to make everything different. It's about digging in and sludging through it and coming up with really meaningful and valuable things that we can rely on. So I think right now there's probably nothing more critical than to think about the work that you do and this kind of work in regard to policy. And it's something that I want to talk a little bit about how I've been thinking about it, and particularly for students here, something that you might want to think about as you move forward. So starting off with something that may be generational. So people of my generation know about this phrase that we used when we were young about speaking truth to power, which actually we borrowed from Gandhi and Martin Luther King. Actually, we borrowed it from Martin Luther King, and he borrowed it from Gandhi. But the idea here is that there is something about trying to understand what is true and to speak that to power, and that in and of itself has power. So if you ever want to go back and read about some of the actual techniques and methods Gandhi used, it's really impressive the way he took just this simple idea of we're going to say what's important and we're going to stick to it, and we're really going to have a real strong base for what we say, can start to move power that seems to be otherwise unmovable. And of course, Dr. King took that up. I don't have any pretensions of having anywhere near the kind of capability or understanding that these heroes of ours have done. But the idea that we could speak not truth to power, but maybe what research can do is try to bring the idea of truth to policy is really a valuable one. And so I want to talk a little bit about what research I mean by that, how, from my perspective and experiences, researchers and policy people think quite differently, have quite different interests and constituencies, and then how that might be something that would be valuable to look at, plus talk a little bit about some of the work we've done to try and be policy influential. I work at a center called Youth Next, and part of this is the idea that we can bring research to policy. So it's Next as a nexus, as is we're a place to intersect different knowledge bases. And the name itself is meant to be something that makes sense to people who aren't in academia. And we thought instead of calling it the Center for blah, 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 we'd let the academicians struggle a bit with the name. People outside of academia get the name like this. People outside, inside are like, why is it not called the Center for blah, blah, blah? So anyway, and our goal is to do something that's relatively new, although again, you're probably among the people here who have been thinking about this, is how do you understand how things go well? Why people develop to be effective, capable citizens engaged in their social life and societal life and having good relationships and having a job that they enjoy or at least they find satisfying and so on. How does that happen? Because most of what we've studied is how does that not happen? And so this new center was that started was 3 years ago, was the idea of maybe we can understand that about adolescence. Maybe we could, in particular, but children growing into adolescence and adolescents growing adult, how do things go well? So that's the focus of this center. And the reason I mention that, besides the fact that I, as a director, I have to make sure I tell you about it every time I come, or I got to subject you to, since I'm from the University of Virginia, several Thomas Jefferson quotes, and I thought I would do this instead. So it's the idea of taking research and training and application and really trying to connect those. The place I worked at before, one of the themes we came up with is, as you conceive of a study, what's the end use? Whether you're a geneticist or you're somebody studying how organizations disperse power, what's the end use of that research? And that's part of what we brought to this idea. And so that's part of the idea here, is to be thinking about your research from the beginning of, well, what would happen when I find out my results? What's that really going to mean? And what do I really want to do with that? And let me give you, for just 4 questions that I suspect you all will recognize are important, but then to think about how important these are. So one of the big questions that's been going on in education for the last decade is, should we worry about school size? Are small schools better? That got to be a mantra. There was some data that seemed to support that from some studies and so on. Second question is, what is it about teacher and classroom quality that's important? So is it the relationship they have with the student? Is it the content knowledge they have about science or mathematics or English or something like that, that they can then have the right material? Or is it about their ability to manage their attention and their reinforcement of different kinds of behaviors around the classroom and to bring people into instruction that way? Where do these things make a difference? These are hugely important questions. And if we can get some direction on that, it could make a very big difference in how we train teachers, the effects it has on students, the competitiveness of our society with other countries, and essentially the quality of life. Not a small question at all, probably as big as and as important as one that we can have. Does early intervention help? There's evidence that Head Start makes a difference. There's evidence that Head Start doesn't make a difference. Depends on the Head Start you're talking about. And there's a lot of questions about how important is this and how long does it last and what are the long-term effects. If you're thinking about trying to work with kids at risk or problems in schools, whether it's learning or achievement of populations or kids who are, because of their misbehavior and their emotional problems and so on, make it disrupt the classroom or are failing, should you go after those kids who are highest risk, or should you really be trying to create a different atmosphere and sort of support the development of all the children? These are things that if you're working a practice area, you spend a lot of time on. If you're an administrator, you spend a lot of time on. If you're somebody thinking about funding and sitting on a school board, you wind up thinking about these things because they drive your budgets. And if you're a researcher or somebody who's trying to understand human behavior and education, these are among the questions that you might be drawn to try and follow. We were having a brief conversation before I came in here about the importance of having a question you really care about. That's the nice thing about our field. There's lots of really great questions that you probably care about a lot. So you don't have to get up in the morning and wonder if your research matters. It matters. That's the great news. When it's 3 o'clock in the morning and you're working on it and everybody else has gone to bed, you might have some second thoughts about that, but that's what keeps you going, is you realize maybe there is something that will come out of this that'll make a difference. So if we want to speak to policy folks, what we need to do is to start to understand a bit about how they think, and to think about how we think within the context of having to understand if we work within a certain worldview and a certain way of thinking about things that may not be easily accessible to others, typically isn't, and may be that trying to bridge those worlds, we have to start to think differently than we do. So this is just a quick and dirty contrast between how research is oriented and how policy is oriented. Research tends to be, most fundamentally, you have a theory and you go out and you try to systematically test that theory, controlling for or randomizing for control all the other things that could explain the differences you're going to get, other than the one or two things you're trying to manipulate. It's a really simple model. It has a very basic set of ideas, and the rules are absolutely rigid, right? As somebody once told me, I don't like research because it's so picky. And the idea is that you really have to be picky, because all those things that you do can affect whether or not you can believe your results. Politics is interested in theory, so to speak, but really political theory. What do you think are the best things to do for people? What's the best way to run society? And it's also politics in the sense of you really are about pleasing people. It's research, you're not so much about pleasing people. This is really, that becomes as important as do you have a really strong scientific design and do you have confidence in your results? Would it be hard for you to get those results and fool yourself into believing them otherwise? Politics is much more about, fooling yourself is not such a bad idea sometimes. Research is interested in, we're in variables, right? We don't even talk about people most of the time. We talk about variables. We now have studies and approaches that are studies about people, and people talk about person-based analyses and things like that. But mostly we're interested in how does a variable relate to another variable. And so we're interested in whether a variable relates to another variable. Politicians are interested in relationships, how people connect to each other, and what those people want and what those people need and what those people might do to be motivated to do to come out and vote for them. So it's much more. They're interested in people. So a long time ago, I don't know if you all remember Paul Simon, who was a senator from Illinois, and we were involved in, after he had retired from the Senate, he started an institute at one of the universities, and he was interested in talking about services and evidence-based practice. So he got a group of us together, and we started talking about here's what works, and here's the evidence that works, and so on. And he said, well, how many people does it serve? And I said, well, I don't know. Because we were talking about some studies and experiments. And the thing he told us is, he said, the way I get measured is by how many people I serve. So that to me is success. And he says, you guys are right, but it doesn't translate to my work. So how can we start to think about to translate things? And as some of you may know, it starts to translate to how much money would you spend if you did something that doesn't work versus if you did something that does work. That's sort of the one metric we could start to talk about. And the extent to which, if you're going to be serving all these people, how can you serve them well? But the idea was to reach people, not to necessarily make sure that this variable correlated to this variable. And this scientific idea was so important versus whether or not this person calls my office and complains to me. This person, not this variable. We also are very much about increment. It's a very slow trudge. There's studies now of how effect sizes tend to go to zero over about 15 years in healthcare research, in medical research. So, and there's good reasons for this. Some of it is that there's methodological reasons that the more you study something, the greater likelihood it is that what was an outlier effect in the first very careful demonstration is going to be seen as that. There's also things that some of the techniques that can't, and there's ways that you can explain them, and these are fairly interesting articles, although they don't breed optimism. But what's important about that is that these are incremental steps. It takes about 15 years to translate a finding in medical research to actually see it used in practice. So, and about the time it gets into practice is where the research is going to start to question what it is. Oh, in education, we have probably, first of all, we don't have the database of what works, and we don't have the culture of you're constantly checking up on the latest findings to change your practice and to think about what you're doing. And so we have probably even a longer gap between when research is produced that should be helping direct practice and when it's likely to be seen in practice. But it's incremental and it's moving forward. So I do a study and I interpret those studies as this may add to our understanding of, this may help us do this. I don't say, I found out what makes families able to keep their kids engaged in school. And if I did, they wouldn't publish it. My colleagues would think I didn't understand science. I would be wrong because that's not what I found. As you may recall, and there was a reason to pay attention in the first week of your statistics class or your research class. You're just proving that you're not wrong. You're just showing that what you said is definitely not wrong. And that's an important understanding of research. You're always saying, well, I'll be wrong 5 out of 100 times, and that's good enough. And that's our standard, right? With a p equal 0.05 means there could be 5 out of 100 times I would get this result by chance. But so what we do is we conclude that my findings are not inconsistent with my theory. Politics is binary. Politics is, should we put into place this law or not? Should we require teachers to have this kind of training? Should we start to do testing that ties teaching salaries to performance? And that's what they want to know. So Lyndon Johnson was famous for saying he was looking for the one-armed economist. So I changed that here to the one-armed scientist. Do you all know this story? So somebody said he had a meeting with the leading economist of the country, brought him to the White House, and after he got done meeting with him, he said, he says, now I know what to do. And they said, what's that? He says, I need to find a one-armed economist, a one-handed economist. So what do you mean? He says, well, every time I talk to you guys, you say on the one hand this, on the other hand that. And I got to make a decision. So that's an important distinction in terms of what they're looking for. We tend to be conservative. I'm not suggesting our politics. I'm talking about in terms of the way we talk. We're very careful about what we say. We are very slow to do this. I was once, I had a paper that we worked on very hard, and it was really a good paper. I mean, there are sometimes when they go out the door, you're like, oh, I'm not sure. But this one I knew we had gotten something that was important to do and was different from what other people had done. And it got rejected, and it got the most glowing rejection letters I've ever gotten. And this is important. This is a big step. This hasn't been done yet. But I don't like the way you did this. I don't like the way you do that. So it can't get into. And this was one of the leading journals that we were sending it to. So I called the editor up, and who was somebody I had known and had been sort of a mentor of mine over time. And I said, without putting you in a bad spot, can you help me understand this, because I'm very frustrated. And he said, the journal is a leading journal, and its job in the field is to be conservative. He says, you're offering a new idea with a new methodology, and science should be very careful to take on new ideas and new methods and say, okay, we'll publish this as though these are results. Because you don't want theory just jumping all over the place. It's supposed to be careful and conservatively moving forward. And that's what happened. He said, that's why you got these great reviews, but they didn't want to publish it because there were reasons why, and they were right, that the method was, every study is not perfect. No study is perfect. So there were methodological things that could have explained some of our results that we couldn't completely get rid of. It wasn't the strongest sample, and so on. So the conservatism was, we don't want this other idea being put out unless it really, that refutes other theories, unless it really is well done. We want to be careful about that. And so when you feel like sometimes what science publishing is about is saying the right things, so the old guys or the old people at this point that are doing all this judging of your work, if that's how you imagine them, will be happy. It's really about that if you're going to move ideas, we ought to move them very carefully and very slowly and build them slowly. Whereas policy needs to be resolute. We have to make this decision. I once did a testimony for Congress on prevention of violence, and I showed how it would save money. I showed how there was clear empirical evidence that the effects of this were as big as they were for heart disease, for treatment of breast cancer, for whatever might be your thing that people would say, of course we should do this. And the congressman who brought me in, we were walking out, and I'll also tell you that the congressman on the other side of the aisle grilled me about whether or not the data I made I really were reliable and so on, and then had somebody in there who had clearly unreliable data that he went on to tout. So that was an important lesson in politics, that he wanted to get on the record that his guy's data was the data he wanted to believe. But anyway, we were riding in the elevator on the way back to leave, and I said, it doesn't sound like I was very persuasive. He said, these guys get elected every 2 years. He said, unless you could show them you're going to save them money yesterday, they just can't think about that because they're always thinking about the next election. And they got a 2-year window. They really got less than that because half that time they're campaigning. And so that's what they need to hear about, is how this is going to make a difference right now, because they need to pass a law right now. We're always qualifying our results. This, we found this. What's the thing you always write at the end of the article? More research is needed, and here's the limitations of what I did, and here's why you might want to be careful about believing these findings. Right? That's what we're supposed to do. We're qualifying it. Lyndon Johnson, an economist. Well, here's what I can tell you, Senator, but do you want to also be thinking about, well, then by then you've lost because they need to have, what is it I should do? And as I started to work in the policy arena, and others of you who work in the policy arena, you have to, as a scientist, start to think about, how do I translate this and still keep those principles of, I don't say things that aren't true, and I don't emphasize the certainty any more than I really feel I can. But should we spend more money on prisons, or we should put it in prevention? We should put it in. You have to be able to say you should put it in prevention, and you have to feel comfortable saying those sorts of things. And here's why: because otherwise you're not helpful to them. Because they're, again, in Lyndon Johnson, they're trying to find that one-handed scientist. We also, as I said, our main goal is to not be too wrong. I mean, this is one of the things I tell my students is that research is mostly about finding out you're wrong and getting less wrong as you do more studies. So you have this theory and you go out and try it, and usually you're not only not precisely correct, but you might even be fundamentally wrong. That's one of the important lessons. Then you go see your advisor and they tell you about their experience of being fundamentally wrong in their first studies, and they advise you to keep going. And it's really about getting less lost and being more able to be studying the right areas and moving it ahead that way. That's what we do. That's what our careers are about. That's what our work is about. That's what our contribution is. They want to be not wrong too, but they want to be not wrong in the sense that they don't want to be on the wrong side of a political issue. They don't want to put into place a policy that they think that is harmful or can't be defended. And so one of the things I learned one time, we were competing with somebody else for a contract to do services for the juvenile court clinic in the county when I was in Chicago, and we were bringing in research-based practice. We were going to do what the science said, and so on. And what the other people brought in was a really good connection with the chief judge, and an understanding of ward politics. And so we thought, well, they have to give it to us because we're really the only ones who have the capability to do it, plus we have the credentials and so on. And they thought they have to give it to us. We got the community connection. We can make political trouble for them. And we have this personal connection to the chief judge. And that's when I learned that a politician can always decide not to decide. Grant administrators and grant people have to give somebody the grants when they're out there. Politicians could just decide not to decide. They just took the contract and put it in the file in the desk drawer and put it away till one of us went away. And that took care of their political problem of what to do. And that was an important lesson. That it's not best. There were two pieces of that lesson. One is it clearly was not about the best scientific capability and evidence, because political concerns about community engagement and personal connection are at least as important in a lot of these decisions, and we need to understand it. But secondly, they don't have to make a decision. One thing you can do politically is just put it in the drawer and wait till things have changed and temperatures change and come back. And so as we start to think about that engagement, these are a number of ways in which we need to realize we're talking from very different worldviews, and at least by realizing that, we can start to translate, or we can start to think about the way we can talk about our work, and even think about some of the questions about how relevant are they. That said, laying out all those complexities and suggesting all the challenges and the points of potential frustration, I still think research is our best hope for good policy. There's a group in Washington that has they're connected to America's Promise Alliance that's focused on the agenda for children. I don't know if you've seen this, but they essentially evaluate the political activities in the economy in terms of what it means for the children and the families of this community, of this country. And they don't do it because they love kids, and they don't do it because they think, families are good things and we should make sure families still keep going, or any of those kinds of things. They do it because they believe it's the most critical part of the future of the economy, the future of having and maintaining a real democratic republic. And it's the best hope we have for continuing to be a positive influence in the world. And I think that if the point being that the politics of this are, that's the investment, that's where the difference can make. That's why I started with education and human development research is so vital, because there's probably nothing that drives our economy more than the nature of our schools and how we are raising kids. And yet it becomes the area in which practice is least evidence-based, typically. And it's also the one in which, when we present evidence, it's most difficult to persuade people that this is really meaningful and pertinent. There's one other reason to present this. I used to have a slide called "It's Not Rocket Science." You know how people use that phrase, "It's not rocket science," to suggest something's simple? But if you know about rocket science a little bit, which I know a little bit, enough to be dangerous, I guess. It's a bad pun for rocket science that you're dangerous. Rocket science really isn't that complicated, particularly when you think about it compared to human development and human functioning. Excuse me. Hopefully that'll help. Rocket science really is not that complicated compared to understanding human development, and particularly human development in context. So my argument is that you're right, it's not rocket science. It's actually much more complicated and more important. It's much more important that we learn about this than how to make rockets go up in the air. And that if you're interested in economy-based understanding of why education is important, or competitiveness, or that sort of thing, these are the areas that are most critical. I know you all know that, but I just want to mention that's another way to start to talk about it, is when I started finding myself in conversations where I spent less time talking about why this was a good thing to do, and why that if you look at what people are trying to measure in terms of GNP, or what makes states better places to live, or why people buy houses places, has to do with a lot with education and development, and that's where it's good economics. The other place we can play is that sometimes we can bring some facts to things that are much opinions otherwise. We certainly have moved to a time in our discourse where scientific facts can be treated as though they're opinions. So I had a slide I couldn't get to work here that was a guy sitting at a bar with a bunch of monkeys sort of in the evolutionary stage moving up to a human, and the drunk across the bar says, well, I still think it's a theory. And as you know, we have people who would still want to debate a lot of things that pretty much science suggests are critical. And those are political conversations, and certainly in education and in questions of how we support human development, those are common. But as you said, once in a while we want to be able to tell them the facts are common, and these are things that are important. So a few times in my career, I've had an opportunity to be the person that could bring some facts to a political discussion that helped move things a little bit, helped sway it one way or the other. And sort of nothing was winning the argument one way or the other. Well, here's something we know that's important. Really? We should do that. I'll give you a quick example. So I mentioned America's Promised Alliance. I was at a meeting in America's Promised Alliance, and we were discussing their efforts, which is what they do is they go around the communities and they try to organize communities around the way they serve youth to try and maximize their collaboration and their impact. And they have an idea of 4 things that America owes its children and youth, and it should do, and so on. So we're having this discussion about how they were trying to measure and evaluate what it is they were doing. And the person who was there, who's the new CEO, who just had left the White House, where he headed up some advisory role on some domestic programs, we got talking about adolescence, and he didn't know that we've known for 50 years that adolescence is not a disturbing, turbulent time for most adolescents. Even though if you ask most people in our country, they would say, oh, yeah, that's how it is. And the research has been there for a long time. And we started talking about that and about what did that mean. And that, in fact, we were trying to get people to think about collaboration supporting youth, when really, well, they can think about as collaborations to kind of help those kids who are all messed up, or at least keep them from making us too miserable while they're being adolescent. And it was really an important thing of trying to say, it literally was, my colleague who was with me, another scientist, said, no, here's the facts. I mean, he literally said that, and I said, yes, here's what we know. and it was an opportunity to provide some facts. And it's like, oh, well, we need to really, here's somebody who's listening. He said, we really need to think differently then. This isn't about rescuing problematic kids. This is about helping support kids to move their capabilities forward. So let me give you a couple examples of what I'm talking about in terms of work that might be policy relevant, might be useful, things we've done. And I picked randomized trials because that's the thing I love the most. It's the most difficult to do, I think, of the science out there, because there's so many ways it can go wrong. There's so many ways that you can not get to where you want to be. Plus, you're talking about, in the work we do, things like going in and asking people to let you randomize a classroom, randomize schools, randomize kids to get something you're really pretty sure is helpful, and something that is a control, which sounds not helpful at all. So these are difficult to do. They're expensive, so they're hard to get funded, because you have to have a lot of money to do these. When you start talking about randomizing schools and you need 50 schools in your study, you're up into 7 figures no matter what you do, pretty much. And there aren't a lot of people these days are handing out those kinds of funds to people for studies. So we were lucky. I have really good colleagues that I worked with in Chicago for a long time, and we were able to, and this was in the 90s and in the early 2000s when they were still giving out money, and you could get grants for these kinds of things. But also they were built on a lot of incremental science over many years. So some of these are second, third generation trials from work we'd done 10 years earlier, and some of my colleagues had been working on for 20, 30 years before I even came into the field. Safe Children was a focus on the idea of, from a prevention study we'd done earlier, we found that we went in to help improve parenting of parents in high risk, high crime, high poverty neighborhoods in Chicago. And one of the very important lessons that came out of the data as well as our experience was people don't necessarily, it's not really a matter of there's poor parenting going on here. There's no support for parenting. These people are isolated on their own. They typically are parents when they're younger. They're not very educated, so they don't have a lot of access to resources. And we started talking about, and they were telling us, I appreciate your help, but what I really need help with is, what do I do when I need to go to work and I've got to figure out what to do with my children? Or I can't talk to, I don't like my neighbor and I don't trust my neighbor, so I don't want to let my children out, or those sorts of things. Or I go up to the school, and all I can recall is how last time I was there, they called me whatever racial slur would fit their ethnicity, and told me I should get out. In other words, they go into a school with a sense of, this is not a place that I'm welcome. It's not a place I know what I'm doing. It's not a place that really wants to hear what I have to say. So we started reorienting ourselves in this second trial called Safe Children to how do we support healthy development in high-risk communities? What is it that parents need help with? And this was of some help to me because I was an early parent, I'll call it, at that point. My kids were young. So I also was realizing I needed a lot of help. And my wife and I both realized we needed a lot of help to help raise our children. And so there was this recognition of people, no one raises their children alone. Have you heard that saying? It's one of Hillary Clinton's favorite sayings, and it's one I like. That parenting is embedded in a network of support, of connection. There's somebody, I'll give you a quick story. When my twins were a year old, and I had a 3-year-old at that time, so I'll give you an idea of how tired we were. I called my father, who also, his first children were twins. And I was talking to him on the phone, and he said, how you doing? I said, I'm so tired. He said, I don't even remember what I did last week. And I said, I don't know how you guys did this. And he said, shrimp and beer. And I said, what? And I said, and he was in college when he had his daughters, and he was going to college on GI Bill. So this the important contextual piece. And they lived in this trailer park kind of thing at Penn State that a lot of students lived in it at that time who were married and had children. He said, every once in a while, like every week or so, we'd put our pennies and nickels and dimes together, and we'd make a big playpen, and we put all the kids in a playpen, and we'd go buy shrimp and beer. And we'd sit back and relax a little bit. Kids were safe, and we could talk to each other and get a break. And it was like, so that's an example of embedded parenting. I got that advice and that help on how to do that. And most of you who raised your children, if you think about it, particularly when they're young, you raised them with help from your neighbors and your family and so on. These people were doing it on their own. in systems that were much tougher and much less forgiving. So we got focused on that idea of positive development. And what we did was we formed these neighborhood groups, people who had kids going into first grade in the neighborhood schools. We put them into groups together. And around that, we organized information, practice, and discussion about important issues that they were facing and that we had been able to identify as likely to be faced by parents in those communities. And so they range from how do you things that we're typically do in parenting, like monitoring and disciplinary consistency, but also how do you get help if you need it for a respite, or what kinds of things have you done that work so they could have an opportunity to experience themselves being helpful to other people, and how do you go up to and talk with your teacher? What's the teacher expecting of you when you come to a teacher meeting and so on, so they could be good consumers, if you will, of schools. And then we also started doing tutoring with this, mastery-based tutoring with the students, because there was empirical evidence that particularly in these kinds of schools, phonetics-based mastery learning has positive effects for the kids. And also we know that the schools that they were going to were often failing in just the basic fundamentals of reading approach. And so anyway, we did this for a year, and we had nice outcomes a year and a half later. The kids were on par with the national norm in terms of reading, whereas the kids in the randomized, sitting right next to them, same classroom, just randomized and no family intervention and no tutoring, they were about 6 or 7 months behind the national norm by then. This is just by second grade. And the kids that were having problem with behavior, had better improvement in behavior. The parents parents stayed involved in school instead of dropping off like was typical for parents. So we had some nice promising effects. So then we went and tested a booster in the 4th grade to see if that made a difference, because there was a question of would this last, because as you know, a lot of these effects don't last. So these are the long-term effects. These are these kids in 12th grade. Last intervention was in 4th grade. And some of these kids had the controls are no intervention. The initial only are people who these are the kids whose families had the family group in 1st grade. And the booster, which is the yellow, those are people who had the initial intervention, then they had another family group of about 12 or 14 weeks in 4th grade. And we did a reading club instead of, obviously you don't want to do phonetics in 4th grade. And so what you see here is, in fact, is that we have a reduction in terms of important outcome, amount of delinquency. And so what you see is that the initial is lower than the initial and the control don't show any significant difference, even though the initial looks a little bit higher. But the initial plus booster is significantly lower. So if they were in the initial plus booster, we're showing reduced relative levels of delinquency when they are in 12th grade. And we have this also from some official records too. And then also we saw what is called on track to graduate, which in the Chicago schools is actually better predictor of graduation than is trying to get the attendance records, because the attendance records tend to be behind and they tend to be unreliable and so on. So this is probably the best. This is what Chicago uses to measure graduation probability. And what you see is, in fact, is an increase of about 9% more kids graduating, or what's about a 29% increase for the booster, but also a significant increase for the early only. So this is 10, 11 years later, we're seeing benefits of the supportive intervention in what are some of the highest risk communities in the country. So it suggests that these things can make a difference, and they're important, and that this is something that we might want to go back and try to do. That's the point. And it's done through a randomized trial and through careful follow-up and so on, and over a substantial period of time. So this is another type of question, which is, should I focus on making my whole school organized around reducing violence and reducing aggression, or should I go and find those kids who are the troublemakers and are most at risk and are making the biggest problems? Because maybe if I get them under control, then everything else will stop, or they cause most of the trouble. But it could be also that we have rules around here and norms, and partially because of their behavior, where other kids think it's okay. So if I can change that, make a difference. Because if you look at aggression and violence rates, about 50% of that is from these high-risk kids, and about 50% is out among the general population. So it's not a simple problem of there's clearly a group who are a problem, clearly the rest of the kids are okay. Particularly as you go to middle school. As you know, when you go to middle school, what happens is the kids who are higher risk, they kind of keep going along at this high risk level. And the kids who weren't lower risk, there's this middle school effect of they increase their risk. So this big question for middle school principals. And this is what they were asking the Centers for Disease Control about. And so they put out an RFA for people who wanted to do a comparison of whole school, what you call universal, or focus on high risk or selective approaches to youth violence prevention in middle school. And we actually wound up collaborating with 3 other universities, so because we had we had to have about 36 schools to do this, and to find 36 middle schools, you got to have a lot of places to work, as well as the way CDC funded this was what we not too sensitively referred to as a shotgun wedding. Do you know what a shotgun wedding is, any of you? So those who have not crossed this old, it would be when the father of the bride would use a shotgun to get the young man to follow through on his obligations, and stand behind him at the wedding, I think was the metaphor. The reason I mention that is because we got criticized since we were studying violence for using that metaphor. But the main point of this was they took 4 groups and they said, you each look like you all have capability and you all applied to do this, so now work together on this study, which sometime would be another interesting discussion about what it's like to sit down with about 14, 15 other investigators and say, okay, let's plan out what we're going to do together for the next 7, 8 years. Going back to the study, we started looking at early adolescence and middle school, recognizing the risk patterns that have been identified pretty well there, that it's a time of decreased engagement, more alienation from family, more risk behavior being spread more widely across the general population, less concentrated in a high-risk group. And there's a rise of the social group as most influential, peer groups being particularly influential. And so we designed these 2 interventions, one which followed on the existing literature on the most likely thing to have effect is social cognitive training program, and also do teacher training on teacher stress management, but also classroom, how they were managed in the classroom, and then to provide the teachers consultation. And the selective intervention was an outgrowth of the sort of the Safe Children approach, where we did 15-week family group focused on parenting, school achievement, and school involvement. And then we did a combined condition. And I'm not going to talk about the combined condition because essentially the takeaway from that is it didn't add anything to the particular interventions. So first thing we said is, we also said, let's study the general population, but let's also study a high-risk population. Most studies, what happens is you study a population and then you break it apart to look at it. And there's a problem there of it's no longer a randomized trial once you do that, because you've broken your sample artificially. So we went and did 2 different samples. So the first sample, this is the whole school sample. So this is 100 kids from each of the schools over 2 cohorts. So it's about 6,000 kids. And what we found, what was interesting is that in the schools where we worked with the high-risk kids, that's where we had the biggest effect. That's where we had the effect on the general population. So even though we were working with the high-risk kids, and we were working with this social influence theory of peers, we found that the kids who weren't the high-risk kids, the kids who were just the kids in school, they reported they were engaged in less violence. And it looked like maybe there might have been some of that same kind of effect for victimization from doing the general population. So we started to see 2 very different mechanisms of effects. If you wanted to decrease victimization, you might want to do this general kind of norm kind of thing. If you wanted to decrease everybody's aggression, you might want to focus on those high-risk kids. Well, let's see if that actually happens. And this is the way the effect looks. So the green one is the selective. And you see how it starts to break away and show a different growth pattern. So this is growth from the beginning of 6th to the end of 8th. The others are pretty much going right along with the controls. So here's what we found, and let me just see if I can. So Here's the one that's really probably most important to look at is, where did it go? Yeah. This one here. This is the selective focus on violence. And what you see is, in fact, the finding is consistent with what we had from looking at the universal sample. It's high-risk kids report themselves that they're engaged in less aggression. They're being less violent. And also they're less often using things about pushing people around, getting your way, fighting, and so on, when they're facing conflicts. So they're actually arguing that they're thinking differently, and they're being less aggressive. And that seems to be consistent with, if not explaining, why we're finding overall lower effects. So here's an interesting idea. You can work with this group, and it's going to affect the whole population, because they're not only acting different, but in some ways that we haven't quite been able to parcel out yet, they're affecting the overall kids. And then the other thing we saw was, well, wait a minute, you're working with families. How could that social influence piece work? Well, this is the monitoring the parents are doing between the parents who are in the selective intervention compared to other parents of high-risk kids who are in the control. And what you see is, so the selective intervention, they're kind of maintaining. This is an important difference. They're not getting really good at parenting. What they're doing is what would occur typically in families otherwise of less and less keeping track of the kid, they're managing to still keep track of the kid and be involved with them and engage them and follow them. Similarly, the families keeping their cohesion, which is kind of the emotional closeness, the connection, and so on. Remember, this is typically a time, and here's the typical developmental pattern of decreased closeness, dropping off of that, whereas meantime we're kind of keeping that. And that's one of the things you find a lot in this kind of prevention research. It gets problematic when you try to talk to policy people. What I'm going to do is I'm going to keep something bad from happening. So what do you mean? What are you going to do that's good? Well, I'm going to make nothing happen. Well, we'll put a lot of money into that. So it's a very problematic kind of how do you tell people about these things. Sometimes the way you can get there is you actually get an opportunity to answer questions they ask. So with the reauthorization of what was, I forget the exact name of it now, but it's No Child Left Behind, the reauthorization of that. There are people at the Department of Health and Human Services and at the Department of Education that were very interested in this question of social-emotional learning and the growing research that suggests social-emotional learning is not just a nicety, it has impact on academic performance. It also has significant impact on employability and other kinds of issues that, again, start to speak in economic terms, and that is always helpful when you're in policy. So we were asked to come and do a briefing on what do we know about the importance of social-emotional learning and how that relates to academic performance and behavior. And there were a group of us that presented. And we had about, I'd say, a big part of the leadership in education and a big part of the leadership in the area of HHS that's related to issues of emotional development and so on. And we were able to do 2 briefings in 3 months where we could go through this and talk about it, and so they could start to consider how they're going to try to include this in the administrative efforts around this. And you may or may not know this, I don't know if it directly came out, but there is a bill before Congress that would make social-emotional learning part of the expectations for performance in schools. Illinois already has a law like that passed, primarily through the work of my colleague Roger Weisberg and his organization CASTLE. But there's now one that's been introduced federally. So once in a while they actually do want to hear what we have to say, and we do get to tell them things. The other thing you can do is you can start to talk to them about how this affects outcomes. So I have a colleague named Steve Oss who works at a place called the Washington Institute for Public Policy. And Steve is an economist by training, but he's gotten very interested in education and human development kinds of programs and what they mean. And he works, the Washington Institute for Public Policy is a nonpartisan institute that works for the legislature of Washington State. And they hired Steve and his group at this policy group, or they funded them, probably about 15 years ago, maybe 20 years ago now. And what they do is Steve also does meta-analyses, and out of those meta-analyses he does cost-benefit. So he goes and looks across all the studies on a given set of interventions or across different interventions, and he says how much effect do they tend to have, and then if you think about what their impact is, what's the cost saving versus the cost to do these? That's what cost-benefit analysis are, right? So you say it costs $3,000 per kid, but it's going to save you $15,000, so you come out $12,000 ahead if you think about the long-term kind of thing. And so he was asked initially to speak to them about crime and delinquency and to what the effects of various kinds of crime and delinquency prevention programs might be. And he did this analysis, and he got them to fund where they would give each court system more money if they used this list of evidence-based programs than if they continued to do what they were doing. And he did that through showing here's how much you'd save if you use these programs versus if you could continue what was in operation, which we knew it was going to make almost no difference in the crime rate. Because if you don't have an effect, you can't have a cost, can't have a benefit, right? So he knew they weren't going to have it. So anyway, so he worked with them over that. He's now worked on education and children's mental health and child welfare. And among the things that the impacts he's had is that Washington took money it was going to put into a new, what they call residential center for youth, we would call it jail, and took it offline and put that money back into prevention. And Pennsylvania's just done the same thing based on the findings from these kinds of studies. And the way it works is through these cost benefits analysis. And this is one of Steve's things where he presents to the legislature and he says, let's think of this like stock. Let's think about this like investment. You can do high risk, you can do things that you don't really have to worry about risking your money, and you can do moderate kinds of investments in this new idea of you only fund evidence-based practices. That's the risk, is you only fund evidence-based practices. You don't keep things going. Stop for a minute and enjoy the irony of that idea. The risk is in putting things in that we have things into money, into things we know could make a difference, as opposed to things we're doing that we don't know, have any idea whether it's making a difference. And so anyway, but you're trying to change, and Steve's very thoughtful about this. And so this is essentially, if you just make a moderate shift in how you put your funding to those things that are evidence-based, what the effects would be. And so you can see the dates are 2008. And it's going to cost you a little bit first year. And the second year, you might, and about 4 years later, you start to, it's going to be about a flat return. This is for crime, but you can, the principle applies to education and other areas too. And here's the benefits over time in terms of the relative costs. And they're huge. And so this idea has started to take some hold. Do people know about social bonds? The idea of social. So you know how you can invest in a startup, and if it makes a lot of money, you make a lot of money? Well, there's this idea that you start to create governments, get investors to invest in evidence-based programs or social programs, and then essentially if those programs save money, that money is supposed to be paid back as a dividend. And I know that there's at least one state around this area that started to look at this. So, and it grows out of this idea. So you can start to see how this is maybe turning into something where this research can really start to make some difference in the long run. Now, there's two things I would say. So we can have an impact, and I think it's well worth doing it. And I hope that those of you who are starting out and those who are already well on your way, that you'd continue towards trying to think about how you can use your considerable talents to focus on research as our best hope for moving towards these kinds of things. Can you guys see this? Okay. So you see that they're saying the drug has a better effect than psychoanalysis. You have to do studies that make sense. You can't just find an interesting idea and go ahead and approach it. And rat psychoanalysis is probably not a critical way to compare the effects of one approach versus the other. And the other thing is that we have to keep working on being a little more clear and specific about what we mean. So this is my cartoon for what most of our intervention research looks like. Is we have all these ideas and theories and data, and then we go do something. And then all these good things happen. So we have to start to get a little clearer about what's going on in there so that when we do go to the scientists or go to the policy people, we can say to them more, we can say, for example, here's why you want to promote really high quality teacher-student interactions. because it makes students more engaged, because they learn more, because the teachers are less stressed out, and to be able to show all those links and say that. And by doing that, here's what happens. And hopefully, at some point in the future, I'll get to hear about some of the work you're doing that does that. Maybe, hopefully, because somebody will say, oh, there's this new bill on the Hill or whatever, and here's what's involved. And it involves some of the work that you all have done to help us get there. Thank you.
We have a little bit of time to take some questions, and I'm sure that Dr. Tolan will.
Yes.
I would like to say thank you for validating much of what we're already doing as teachers and, how it's applied in the classroom. Oh, can you hear? Yeah. Could everyone hear me? Thank you, Dr. Tolan, for validating much of what we're already doing, in the classroom and parenting education and student education. So many implications for classroom, not just for research, but for the classroom. Thank you very much. Really appreciate that.
Thank you.
Oh, thanks. Hi, that was great. So I agree with your take on policy and the different things that the world of policy wants compared to what the scientists want.
Mm-hmm.
And the problem is that we don't train people to be able to speak to policy.
Mm-hmm.
And I'm wondering if you know of any place in the United States that has a PhD program that includes policy, speaking to policy and speaking to lay people about science, because I would love us to do that.
Yeah, and I think the short answer is no, I don't know of anyone, and I will bet that there probably is very limited. If there is, it's done informally, and it's done like, come sit in the audience while I do this thing, and let me explain to you why I did it at a testimony, or we're going to meet with this secretary of this or something, and you can be part of that, or you can help do some legwork on a commission. I'll bet it's not done in any kind of formal, here's just 10 things you ought to think about.
So minimally, wouldn't it be great if you wrote an article that captured some of the things that you told us today, that people could then use in graduate seminars?
I'll put it on my list.
Seriously, because what you do could make a big difference.
Well, thank you. No, I don't mean to be dismissive. You're actually just tapping into some of my anxiety about the number of things I have on my list. Thank you. I think that maybe that is something to talk about and write about. Thanks.
Well, I do think they do a little bit of policy analysis in family studies, and we've had quite a little bit of that kind of work going on at our national meetings and so forth. And some of our students have been particularly also looking at impact of policies that are in place that then are in conflict with things that we do know. Mm-hmm. And I think there's some policy analysis to be done. For example, I have a student who just did her dissertation on looking at how disabilities policy and aging policy don't really work together when you have an adult disabled child living with elderly parents. And yet those two sets of policy could easily work together. So I think it's also sometimes coming from the policy and back to the research, not always just building out from particular studies we've thought about doing ahead of time. And I think it's important for us to also be saying, well, which policies are affecting people? They may not be strictly education. They may not be strictly family. Mm-hmm. There may not be strictly health policies. But in some respects, it's the way these policies affect people at all these different stages, and the fact that many of them are simply in conflict with information that we do know.
Yeah. Well, I think that the extent to which one can help align policies with the best evidence, or the extent to which one can sort of start to study empirically kind of what are the impact of different policies and feed that back. Those things actually do carry, I think, more currency than do our theoretical studies. So, for example, in the school area, analysis of data sets about what they show in trends has much bigger impact these days than do randomized trials for lots of reasons, but in ways that can sometimes make it harder to do a theoretical study, because somebody said, well, I can just go analyze all the big schools and all the small schools and I'll see which ones look better and which ones look worse. Well, you can, but that's not causal. And in fact, that's what started to unravel in the big schools, small schools, is that as they started to look at it, they realized that this was really trend analysis, and as we all know, trend analysis is heavily susceptible to lots of other variables and biases and stuff like that. And as it turns out, big schools and small schools is too big of groups to really make sense out of what's good and what's not. So I think your idea that people need to be able to, my comment was along the line of how can we start to bring sort of empirical analysis to policy and say, here's what the policy really does, here's how it really makes an impact, and if that's not what's intended, what can we do to change that?
I have a question just on, seems to me some results are almost immediately implemented. So when you figured out you put a third brake light in the rear window of taxi cabs, you know, in no time at all, that became an industry standard.
Right.
In our field, there's pretty well rock solid evidence about social promotion and retention. Nobody believes it. And it's very hard to have policymakers support,
right.
You know, what that, you know, 50 years of research on that question. Yeah. And there's others on tracking and skipping kids' grades and any number of things that have been really well researched. And they go nowhere. And I'm wondering why would you think, what's the resistance on, I mean, there's a clear resistance, so it's got to be lawful. I mean, there's some reason here. What would you think it is?
Well, so start with your comparison. I mean, that is an interesting comparison, although I remember airbags come in. You look like you might be of enough age that you remember airbags coming in.
You're very kind.
Those of you who don't know, it was a huge fight. Long after we knew airbags would save thousands and thousands of lives a year, there was a huge fight because it was going to increase the cost of cars by what at that point was a big amount of money. I think it was $1,000. And the argument was people would not buy cars if you did this. I mean, if you think about that, it doesn't make a lot of sense. But the argument was that would just push cars, American cars in particular, to be non-competitive. And now, can you? And I'm just going to make a bet that there was studies years and years and years about brake lights before they got put in the window.
It was 10 years. You're right.
Yeah. So it's not as though. That said, your point still stands, which is that there is a credibility issue around our research, and I'll tell you what I think it's about, but this is just what I think, and for whatever that's worth, one is that we're talking about human factors, and human factors are very open to personal theories, right? So I think this, I think that. Well, you know, so for example, I'll lecture about, we have very clear evidence that boot camps make kids worse. Very clear evidence. One of the replicated findings across independent studies, the kind of stuff we love to find in science, and we rarely do. And I'll do that almost inevitably if I'm talking to a bunch of people who do youth intervention. Somebody will stand up and say, well, I run a boot camp and it works. And they may be right that their boot camp is the one that works, and you know, but I'm not ever going to persuade them it doesn't work, because it has that human factors piece of they have a belief, they have an experience. The only thing I can relate that to is I was once, because for deserved reasons, in a driving school, and one of the people who was there with me was talking about why he never wears a seatbelt, because he knew that if he ever got in an accident, the best thing to do is get thrown clear. And he wasn't going to be convinced to wear his seatbelt. So there does occur in other areas. To get back on track, to your point, the second thing is I think we undercut ourselves. We go around with two things, that we give more credence often to theory and opinion than we should. We're not as tough on each other as we should be. I have a colleague who studies cancer and liver cancer, and he also happens to do prevention research. And he said, you guys are so nice to each other and so careful not to be critical of each other in a meeting. And then you tear each other up when you go to do a policy discussion. My model is the model you got to do. Here's why, and blah, blah, blah. And the other guy's got a model that's about this much different. Don't do his model. And he says it's exactly the other way around in our field. He says we tear each other up in the meetings, but when it comes time to talk to somebody on the Hill, this guy's work is the best work in the world, this guy's work is the best work in the world. If you keep funding us, we're going to cure it. So that's part of it. And we lend ourselves to allowing theories to continue. And we promulgate theories long after they should have been tested or the research doesn't support. So I think that's our piece of it, along with the idea that everybody is a amateur human development theorist.
Yeah, I think we also relabel the old stuff as new stuff, so we can take credit for it. And you lose the continuity and the incrementalism.
Yeah. So we did this in Illinois. We got them convinced to say, we'll fund your community startup project for youth development for 3 to 5 years, but you have to produce evidence from it, or you have to be doing something from this list. And it led to a lot of people going to lists, and that was a way to make the change because people would repackage what they were saying. Oh yeah, we kind of do that kind of thing. But also it allowed people to have a chance to show that what they do really does work, because that's part of it, is everybody thinks their school is different, their community is different, and so on, right? That this is unique, and we need to do things the way we need to do it. And so in Illinois, we took that, we got them convinced to take that bet, and it led to a lot of, in youth development, to a big influx of using evidence-based programming. Yes? I think you need to get them, she's coming.
All right, trying to figure out where the mics are. So, personally, I'm a big fan of evidence-based policy. I've been involved in numerous randomized field trials for almost a decade. But also, having been involved in those studies, I recognize that it's often the case that interventions don't really work nearly as well as we'd like. And I would say, there's certainly obvious benefit to identifying programs and policies that don't work to make sure that we don't waste money on them. But what I'd really like to see is us be able to develop and recognize sooner really promising interventions that are going to produce really powerful effects. Do you have any insights that you can provide to us about what you've seen over the years in terms of what is most likely to maximize effects?
So I don't know what you mean by really powerful effect. I assume you mean a big effect size.
Yeah, a big effect size. Something that...
So I'm going to disagree with you, and here's why. Not because I don't have the same wish you have, but because I think that may be creating a situation in which we're expecting things that aren't likely and maybe dismissing things that are very important. Do you know what the effect size for aspirin is? Taking that baby aspirin is on death rate? 1%. 1% decrease in death rate if everybody who's at risk takes aspirin. Now, not everybody does it, but so you methodologists, close your ears for a minute, but that's about an effect size of 0.01, 0.02, something like that, generally. And if we came in and said, I got an effect size of 0.02 for this thing that we're going to do with all kids, and it's pretty cheap and stuff, yeah, but nobody wants to do that. That's not enough. And effect sizes also have to do, again, your methodologists can now open your ears. It has a lot to do with who your sample is and what the base rates are and all these kinds of things that are important. So the reason I'm disagreeing with you I share your desire, is that maybe what we need to be thinking about are pretty good effect sizes where I was waiting for somebody to say, wait a minute, you still got only got 45% of these kids graduating. And nobody said that but in that school, the norm is 35%. So now almost a third more kids are going to be graduating. Now, we shouldn't be happy with that. We should be looking for something that's going to boost that effect size up to 80, 90, 100%. And we should but my point is, I don't think there's something to do that. I don't think we're going to do that with the thing. So what I would argue is to not oversell this, but to argue that things that have impact on general population rates or high-risk populations of changing these rates 10, 15%, that's pretty good. And we should be doing those. And here's my punchline. It's a whole lot better, and I have no idea what the effect size is. So why not do this thing that has at least some effect size? Which is, for most of our practices, we have no idea of what it's doing. We think it maybe makes a difference. We don't know. We believe in it. So. Yes.
You know, it seems to me that one of the issues is that policymakers don't use the same standard of evidence that scientists use when they make judgments about things. So there's a problem of translation, helping policymakers understand what standards of evidence they should be using in making those judgments. And I think scientists don't know how to do that because they don't engage policymakers often. And probably are not sensitive to the concerns that policymakers have, as you described. So can you think of any institutional mechanisms? Perhaps we could even be thinking about it as a college and working in a very small state like Delaware, where we potentially could influence policy that would help to facilitate that communication.
Right. So I think is this trying to, what that one slide was trying to do was to be aware. I mean, the way I talk about it is when I first started taking steps into policy, and I thought I was going to go to the legislature and do a briefing, and they were going to say thank you very much and go get things going because now we finally have the direction. Of course, that didn't happen at all. But what I did learn, which was lucky because one of the legislators sort of took me aside and said, "Let me tell you a few things," was that I was there to help them do their job. They were not there to get what I knew from my research was a good thing done. And that's a really important distinction. That they are professionals. I got respect for their professional capability that I have for a scientist doing things well. That they knew where it could play. They knew what couldn't play. They knew this guy, all you had to do was feed him lunch, whereas this guy, you had to take him out and make sure he thought he was the guy who made this happen, and he understood the politics, the people part of it, and that our job is to be there, to do what we do, and to help them understand that. And the second is to start getting comfortable with the difference in the conversation. So prevention works. It'll save us $14,000 for every $3,000 we spend. And making those kinds of statements that you never would make as a scientist. But that's what they need to hear, because the alternative they're hearing is that prevention doesn't work and it's going to cost us $14,000. And so you have to put it into plain language. Now, in terms of, I don't know, specifics of Delaware, but I would imagine one of the nice things about being small is that access to the legislature and the government is very ready, and you're at state university, so there might be kind of that engagement as an act of, I don't know, this may already be going on, but an office or a way in which we want to help support this, and we want to be somebody who's available to the governor's office to do this. Sort of like one of the things I tried to promote at one time was talking to people about more Washington Institutes for Public Policy. It's nonpartisan, but it's bipartisan, and it's funded to do studies to answer questions the legislature wants answered. And what Steve did, which is political genius, or smarts anyway, was he recognized that he had to absolutely maintain neutrality and absolutely answer the question they wanted to answer, not the one he wanted to answer, which is what we scientists, when I've been on these panels on the other side, I've said, look, here's what you need to understand about scientists. We're driven by questions. We really do care about our ideas much more than we care about your particular issue. And we might try to, we're people, we care about, but don't try to tell us we shouldn't care about our questions. And so Steve's smart at understanding that had to be left. What he had to do was answer the questions they wanted answered, even though he had great interest in answering other ones. So those are some ideas. I don't know. You've got leadership here clearly, and you've got relatively small state with a great deal of resources compared to many states. You didn't know that, did you? That Delaware has lots of resources compared to most states. That's the way people talk about y'all. But so anyway, that would be my 2 cents. The other is to bring people in, brief them, and to be available for briefings. The Virginia Commonwealth University does a forum every year for the legislators on children and families. So they've connected to the chairs of those committees, and they do. Illinois had the women legislators had a retreat every year, and it typically was. And then they have so you would go to wherever they were going to have their retreat to figure out their legislation for the season. And so we would work very hard to be among the people who did that briefing. And then there's they're out of Wisconsin. I forget what it's called. I think it's a Forum for Family and Youth. They do state legislation briefings, and most states have somebody who's connected to them. They start out in Wisconsin. I can't remember the name of it. I can get it for you.
Just 1 second to speak on global perspective, what we as policymakers and researchers can learn from other countries.
Yeah.
I know that's a whole...
No, as my brother says, he's a professor. He'll talk about anything, and believe he knows about it. International perspective. So Nancy Guerra, who's is your associate provost, is it? Associate provost for international studies, is an old friend and colleague of mine, and we're actually working on trying to come up with this idea of how do you measure positive youth development internationally so that when you do outcomes, they're culturally relevant, but they're cross-culturally comparable. So I have some interest in this idea, this internationalism. I was also on a commission last year that compared Virginia to Singapore and I think I want to make sure I get it right. It's one Scandinavian country. I believe it's Norway. They have the 2 best performing schools systems, the highest graduation rates and highest. And what were they doing that we should be trying to emulate? And so I've been focusing on this a little bit. So 2 things. One is this idea that we are in a global world and it's a global community, and particularly the people who you're going to see in college and in graduate school, they're going to be part of that digital community, and that's going to be the way they should be thinking about things, even if they're going to stay focused and local. And that if you're thinking about global competition, that there are things that are politically probably are non-starters, but like we came out with this comparison, teachers it's very hard to get into education colleges in Norway and Singapore. It's among the most competitive. That's not the case here. It's a very high prestige job that pays relatively well. Not the case here. More hours and excuse me, classroom size, that doesn't seem to be what's really different. It seems to be something about the way who's coming into teaching and how they're being rewarded. It's a big part of it. So I'm trying to locate your question, but if it's around us competing internationally and the quality of our education, those are 2 things that came out of that analysis. I suspect there's been other analyses that, I think there's been some argument that our kids spend less time in school, and that seems to be a trend, although you can find exceptions. So if that's what you're talking about, I think it's this interesting question of what I think is probably not a politically very palatable kind of thing right now, which is what are we paying teachers and how prestigious is it? And what does it mean to get into an education school and graduate from one, and how difficult is that? So who's the talent coming in?
And I think the other thing to consider is in some countries there's real consistent messages from government policies all the way down, through the school system, consistent messages, right, as opposed to in the United States there's so many conflicting messages, mixed messages. Well,
yeah, I mean, we have real estate-based education, right? Taxes, real estate tax, and then we have it's a state function, not a federal function, officially, at least, or according to, and so you have, and then it's not really even a state function, it's a local function, and so we have a complexity of policy that is almost nobody else, I don't think anybody else in the world is trying to deal. Almost everybody else has federal policies and federal-oriented functioning around, so it's consistent. So the idea of consistent state standards, those kinds of things that we're starting to have in this country, those go on everywhere. They don't have to worry about that. So I think you're right about that. Again, I don't know that those things are going anywhere, unfortunately.